Hi, I'm Dr. Marnie Luck, naturopathic doctor here in Toronto and co-owner of Annex Naturopathic Clinic. Let's talk a little bit about vaginal health and more specifically pesky yeast infections. So if you have a vagina, more likely than not, you've had a yeast infection. And if you've had a yeast infection, there's a good percentage of you who will have had many yeast infections, what we call chronic yeast infections. So why do yeast infections occur and what can you do to reduce the frequency or eliminate them altogether? First, let's understand a little bit more about the vaginal microbiome. So our vaginas have their own ecosystem, which means that they have their own microflora, so that balance of healthy bacteria and yeast. So the most prominent bacteria in a person's vagina is Lactobacillus acidophilus. So these are acid-producing bacteria that help to maintain a really healthy vaginal environment. There also is Candida albicans, so that's Candida or yeast that also exists in a healthy vaginal microbiome. The problem with Candida is that it is not just a commensal bacteria, or yeast, that means that it grows naturally within the vagina. It's an opportunistic organism, which means if the conditions are right, it will take over and wreak havoc. So why yeast infections happen is usually because there's too much yeast in the vagina and the lactobacillus are not able to keep that yeast in check. So common reasons why yeast infection will happen will be if there's a eradication of that good bacteria, perhaps from antibiotic use, or if the immune system is not working as well, perhaps if you're run down or super stressed, or if there has been an increase in blood sugar levels over time. So eating a high carbohydrate diet makes our blood sugar levels higher, and yeast love sugar and will proliferate if sugar is high. So those are the main reasons why yeast infections can happen. So if we think about what we need to do to prevent them, we want to make sure that the immune system is robust, that energy levels in the stress response are well managed, and that there is adequate lactobacillus species in the vagina, and that you're making sure that the environment is robust and resilient. So often I'll work with my patients to support their immune system to make sure their microflora in both their gut and their vaginas are optimal, and that we are being mindful of diet and stress and other lifestyle factors.